Let's discuss now with infectious disease expert Dr. Amish Adalja. Okay, Dr. Adalja, thank you for being with us because I think a lot of people are looking at this and they want to know more about it. So first off, just tell us about Legionnaire's disease and how this spreads.
So Legionnaire's disease is a bacterial infection. It was first described in 1976 during a convention of the American Legion Association in Philadelphia, which led to this kind of mysterious pneumonia being described. And what it is an infection where you inhale the bacteria and it can cause severe pneumonia in certain individuals, not everybody, but people who have risk factors for severe disease that might be older, they might be alcoholics, they might have chronic lung disease. That's who we usually see get Legionnaire's disease. And it's not something that spreads from person to person. I think of it like an industrial disease. So it likes to breed in water, so cooling towers on apartment buildings. That's kind of the mainstay of where we see it, but we also see it sometimes in other water supplies. And these outbreaks can be deadly, but they're usually contained once remediation is in place, and you treat it with standard antibiotics.
How deadly is it?
So if you get Legionnaire's disease and have pneumonia, the case fatality ratio could be about 10%, and that reflects the fact that the people that are getting it aren't usually the most healthy people. These are going to be people that are in advanced age, have lung disease, heart disease, other comorbidities that make Legionnaire's disease so much more serious for them. And that's likely what we're seeing with these deaths that are occurring in New York City.
So I wonder what you are looking at here when it comes to New York's response, because you have the mayor stressing that there were only 2 confirmed cases when they really launched their response. But there was this Legionnaire's outbreak in Harlem last year, and Gotham has reported that there were supposed to be staffing improvements to help, and they just haven't been able to staff up to where they need to be. The New York City Health Department is budgeted for 56 water ecologist positions, currently only has 35 ecologists and supervisors on staff, according to a spokesperson for the department. How critical is it to be staffed up to prevent clusters like this?
It's very critical that health departments have robust funding. That is not something that's subject to kind of political whim or ups and downs, panic neglect cycles. And we know that health departments all across the country are getting less than what they need. That's always been a chronic problem. So the more people you have in place at a health department, the more resilient your city is to Legionnaire's disease and to many other infectious disease threats that they're constantly battling. I think with New York City, the key thing here was finding the buildings that were impacted, that had Legionnaire's bacteria in their cooling towers, and quickly remediating them. And you can see the results of that because there haven't been new cases for some time. If you look at the epi curve, the epidemic curve, where the cases go up and down, we haven't seen new cases. The cases that you're hearing about that are becoming fatal, those are people that are already in the hospital, which tells me that they likely have remediated the source. We'll know more as days go by, but it does seem that they have been acting aggressively and appropriately with handling this outbreak, which is kind of a function of the fact that we're in a big city that has lots of cooling towers that are going to be impacted by Legionnaire's disease.
I'm sorry, you said they likely have remediated the source?
I do think so, because when you look at when the cases occurred and base that on the incubation period, they haven't had new cases occur. So it seems like we're not getting anything new, which means what we're seeing in the hospital, these are people that got infected prior to that. So they do seem to have gotten control of it. But we'll see as time goes by if any new cases pop up. That's going to be the key thing.
All right, Dr. Amish Adalja, thank you so much. Really helpful to have you take us through that.